This is a presentation on how to use maintenance and emergency inhalers. There are 4 things you should learn in this video: why an inhaler may be needed, how to reduce the effects of an allergic reaction, the difference between the maintenance and emergency inhaler, and how to use a maintenance and emergency inhaler. Why you might need an inhaler. Inhalers make breathing easier. When allergens or bad air get into your body, your lungs squeeze together and make a lot of mucus. The mucus and squeezing makes it hard to breathe, but an inhaler can stop this from happening by opening your lungs and airway. Here are some examples of allergens and bad air that can make breathing harder for you: tobacco smoke from cigarettes and cigars, dust inside of hay, pets and animals such as horses, dogs, and cats, mold in your living space, and plants or grasses. How can you stop breathing problems related to bad air? You cannot stay away from bad air all the time, but you can help your body both before and after bad air gets in. Use your inhaler before you see, touch, smell, or taste bad air. Next, we will show you how to use your inhaler. There is a big difference between a maintenance inhaler and an emergency inhaler. A maintenance inhaler is used every day. It controls and prevents asthma symptoms from forming. You should use this even when you don't have symptoms. An emergency inhaler is also known as a rescue inhaler. It is used only as needed for quick relief. This type of inhaler will treat sudden symptoms and asthma attacks. You can also use it before hard exercise or any exercise at all. Now we will explain and demonstrate the process of using both a maintenance inhaler and an emergency inhaler. First, we will look at the maintenance inhaler. You will remove the inhaler cap and add a dose of the medication as prescribed. Tilt your head back a little and breathe out fully. You will then place the mouthpiece of the inhaler in your mouth and seal it shut with your lips. After doing this, inhale quick and deep for 2 to 3 seconds. After this, you will take the inhaler out and hold your breath for 10 seconds. After 10 seconds pass, slowly breathe out through your lips. Next, we will look at the emergency inhaler. You will shake the inhaler for 5 to 10 seconds. After doing this, breathe out fully. Place the inhaler's mouthpiece in your mouth and close your lips around it. Press down on the top of the container to spray the medication into your mouth while slowly breathing in. You will hold your breath for 5 to 10 seconds. After this, remove the inhaler and breathe out slowly. Also, it is important to note that if you need more than one puff, wait 1 minute and then repeat the steps again.
This video will explain how to use an emergency inhaler. So the first step in using an emergency inhaler is to identify what kind of inhaler you have. So here, this is albuterol. It comes in a red body, and it's probably the most common kind of inhaler. So the first step is to remove the cap from the inhaler. After this, you will shake for 5 seconds. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. After shaking, you'll need to hold it firmly. To do this, it's best to put your thumb underneath with your index finger on top. The next step, hold it near your mouth and you're going to exhale away from the inhaler for 3 seconds, or breathe away. After doing that, the inhaler will be ready to go in. So the best way to put it in your mouth is to hold it firmly between your teeth, like this. You can close your lips around it after holding it firmly with your teeth. Do not hold it with your lips though, like this. That is wrong. Do this. So now to actually take in the medication, you'll need to stand up or sit up straight and put the inhaler in your mouth. You'll need to squeeze the inhaler. You squeeze it like this, and medication will come out. Whenever you squeeze, you're going to breathe in or inhale at the exact same time that you squeeze it. Whenever you do this, it allows the medication to actually get into your lungs. And you're going to inhale or breathe in for 5 seconds, and then you'll have to hold your breath for 10 if you can. And that will look like this. You lift your head up slightly, inhaler in, As you breathe out, you'll breathe out slowly, either through your nose or through your mouth. And this should give you the proper time and allow the medication to get into your body. If you need to, you can repeat these steps again, but make sure you give 1 minute in between each puff. So that right there, after that, I'd have to wait 1 minute before I can take another dose of this inhaler for it to work properly. Thank you.
You can check to see how many doses are left in your emergency inhaler by checking the back side of it. There will be a box with a number of doses left in it as shown in the picture on this slide. Thank you for watching this video. We hope you learned why you might need an inhaler, how to reduce the effects of bad air or an allergic reaction, the differences between a maintenance and emergency inhaler, and how to use both of them correctly.